all hospitals, whether it is private or public. The hospitals that have contracts with SHA, they are 10,000. Now, these hospitals that have contract with SHA, we have now trained 55,000 workers. Okay? We still have 150,000 to go. Okay? And once we train you, we don't want to hear a problem.
Yes.
So that problem is slowly coming to an end. But we also have something called SHA clinics. The SHA clinics, we go to a particular county or a particular facility, like the other day we were in Tenwek, because Tenwek had some few challenges. And you know, I usually like to be extremely truthful. That's why I mention even the name of the hospital, because I know, like for example, today the medical director of MPSHA knows I spoke with him. So it is on record, yeah? And of course, we are not saying this in bad faith. So we go to Tenwek, we said, okay, what is your problem? Your problem is this. We sit down. We sit down with the finance team, we sit down with the medical team, we sit down even with the doctor to ask the doctor, what is the challenge that you've been complaining about? Let's go one by one. When we leave there, no problem. We know that this may take time for the entire country, but you know, the system is so simple. And the number 147, if you call it, you will be taken through everything I'm saying. You will even be taken through those clinics. So we are just appealing to members of the public. We are appealing to our hospitals. Let us adhere and implement the President's universal healthcare agenda. This is something that is so personal. Like now, this, my friend, the civil servant, yeah? He works in parliament, by the way. And it's just that because he has my number. There are many Kenyans who don't have my number. Sure. So we must have a way of making sure that our system is working and it is simple, with or without knowing somebody. Okay? Now he has waited for 5 hours for his surgery to be approved, yet the hospital tells him that no, we are waiting. Yet the hospital has not notified the Social Health Authority. You understand? Yeah. So those are cases which it looks like we need to bring a bit more humanity into the healthcare system, so that we just take time. We know that me as a hospital reading this social health benefit package, translating it, making sure that my systems in the hospital are aligned. Every hospital, we are now encouraging them to have a few clerks who are specifically trained on the SHA benefit package. Okay. So that when somebody comes, they just enter your ID. When the doctor writes something, they can know, for you, this is the service that SHA is paying for, so that they align the way they write their notes, they align the way they treat you with what SHA has said. We have had a bit of resistance. The resistance, you know, in Kenya, when something comes new, there's a lot of, oh, you know, it's not working. The other day we were in Bomet, and there was a story, in fact, it is online. So again, this is a story of online, where a young man was saying, SHA is not working, SHA is not working. So we called him. You can, that video, I think you will have it so that you can play it. We called him, oh, okay, we want to help you. Bring your ID. Entering his ID, he's not a member. He's not registered. Okay? That is why we are also encouraging more Kenyans to register. Okay. And by the way, that's another good story. So far, 29 million.
29 million Kenyans
29 million.
Already enrolled.
When I became PS, it was just 11. So I can say that my performance, within 8 months, I have gotten 18 million Kenyans. That is not just a vote of confidence. That is credibility in the system. And the system